if you're in the practice setting where you're not so sure, how you go about with tracking certain things, so for example, you're ordering a narcotic for a patient, then you need to enroll in the prescriptive monitoring program. All right, so hi everyone, welcome to the channel. Thank you so much for tuning in. I am going to talk to you a little bit about the prescriptive monitoring program. I'm just going to talk briefly about it. You can go ahead and read up on it, but if you're in the practice setting where you're not so sure, how you go about with tracking certain things, so for example, you're ordering a narcotic for a patient, then you need to enroll in the prescriptive monitoring program. So each state has its own monitoring program that you will have to enroll in, and whenever you're ordering any form of controlled substance or narcotic, then you will go ahead and check that system to track any medication that patient has been getting that is listed as being like a sedative, a narcotic, or a controlled substance in general. So I have a patient currently that I am going to be seeing, and for some strange reason, the system that I'm using, I'm not going to call a name, the charting system that I'm using, I'm not going to call a name on that, but it doesn't have the prescription monitoring program attached to it. So in ordering your medication, it doesn't give you the ability to go ahead and look up whether or not the patient has gotten the medication in the last 30 days or when was the last time the patient had gotten it. Should the patient be out of the medication that the patient received the last time, who was ordering the medication, the location where the patient picked it up. So it kind of gives you a brief idea, or not a brief, it gives you a detailed idea about all the narcotics or the controlled substance that the patients will take or receive from anywhere in the state itself. And I love that because sometimes you see patients, and a lot of times in the emergency room we tend to see patients come in every day and they are literally crying because they are in so much pain, and the doctors will be like, oh no, we're not going to be giving you any medications today. And sometimes they probably don't even know why they won't be issuing out the medications. It's because they already checked the system. And when you look at it, sometimes I remember one time there was a patient who had about 5 or 6 pages. The doctor went ahead and print out and bring it to the patient to say, hey, in the last 3 months, this is how you've been using narcotic. And I was kind of shocked. I went through and I was looking and I'm like, oh, all of these are like out of pocket. Patients are paying out of pocket to get prescription drugs, narcotic, whenever they're not able to get it from the emergency room or from their regular primary care provider. They will go as far as out of state. And so this prescriptive monitoring program, it actually protects you, it protects your license, and it also protects the patient, because you don't want to be issuing too much medication that is going to cause patient to be overdosed. We already have a lot of patients that are addicted, and we have a lot of overdose cases that are coming in. So the last thing you really want to do is add to that that crisis that is going on. So it is important that as you get in the field, just try to ensure that this is one thing you ask the provider or your employer, do you have access to that? So that way when you're ordering your medications, you can feel comfortable ordering your narcotics, and you're not ordering blindly, meaning you're just going there because the patient is saying, oh, I need some tramadol, oh, let me just go ahead and order, oh, I need some Lyrica, oh, let me go and order. No, you want to ensure that you're doing the proper steps, which includes listening to the patient, of course, and trying to meet the patient's need. And then you'll go ahead and check the prescription monitoring program, see when was the last time the patient received it, how many did they received, and whether or not they should have enough medication. Because sometimes providers will go ahead and order medications that are as needed, but patients take it 3 times a day, 6 times a day, every day. That is not as needed. You understand? So it is our responsibility to play our part. So what I did with this patient today is that I called my boss and I'm like, hey, for some strange reason the system is not allowing me to check, because there's not a prescription monitoring program that is set up on the system. And so she was like, oh, she didn't know that it wasn't there, but what she's gonna do is she's gonna check for me to see what's happening. So what I did was call the EMR company to find out how to get it enrolled on my platform, so that way when I'm seeing patients, I can comfortably check their charts, I can comfortably check their records to see how and when was the last time they received any form of narcotic. and they were like, yeah, we can go ahead and send you over some paperwork to go ahead and fill out and get that done, but they're also going to need it for authorization from my manager. I'm like, I'm definitely sure that my manager will be fine with it. So I'm going to give you the email. I'm going to give you the contact number as well. So we'll just go ahead and do everything. Send it over to her and just address it as, you know, PMP monitoring to be added to the charting system, authorization access or something like that, and then she will figure out what it is. But then I'll call her back and let her know that she'll be receiving an email. So they went ahead and sent it off, but the only thing is that I won't have access to it today. I'll have access to it about 4 to 6 weeks, which is a little bit long. So I am here sitting down waiting to see what is going to be the next thing, because it means that if I see the patient today, which I don't have a problem, I won't be able to order that medication that the patient needs. So another provider will have to see the patient and then order. And the last thing you want to do is, you know, have two visits for a patient regarding the same thing, because if I see the patient, I'm going to get billed for the patient, and or I'm going to bill the patient, or you don't want it to be a case where I see the patient and another provider comes and see the patient. That is going to be like a total waste of time. But, yeah, so we'll see how that works out. But for the most part, just ensure that, you know, you have that assigned to your charting system to protect your license, protect you. So if you have any questions, please remember to leave them below. If you have any comment, you know, there's a comment section as well. You can always add. And remember, this is just information for other nurse practitioners or other nurses as you go along in this, you know, wonderful career field. So it's an era where we can actually share ideas and content. Until then, thank you so much for tuning in, and I do hope this was beneficial for you.